My name is Karl Shallowhorn. I'm the Director of Community Advocacy for the Mental Health Association of Erie County and Compeer of Greater Buffalo. I also serve on the Board of Directors for the Mental Health Association in New York State, and I serve as a member of the Erie County Mental Hygiene Community Services Board. First of all, I'd like to thank you, Assemblywoman Gunther, for allowing me to come here and speak on behalf of the Children's Psychiatric Center. In way of background, I'm a person recovered from co-occurring mental health and addiction disorders. I had my first psychotic episode at the age of 18 and was eventually given a diagnosis of bipolar disorder 1 with psychotic features. Despite these challenges, I've gone on to complete my master's degree in student personnel administration, as well as obtaining a certification as a New York State credentialed alcoholism and substance abuse counselor. I've been working in the fields of mental health, addictions, and higher education since 1992. I've been married for nearly 21 years and have 2 teenage daughters. The reason I feel I need to share this information is to highlight the fact that people with mental illness and/or addiction do recover if given the proper access to treatment and have the support of family and friends. I've been fortunate enough to have had these things in the course of my personal journey over the last 34 years. I believe strongly that the youth living in West New York who deal with similar challenges should be given the same opportunities. For these young people, early intervention is key. The following statement is from the 2003 President's New Freedom Commission on Mental Health. Quote, "Without intervention, child and adolescent disorders frequently continue into adulthood. For example, research shows that when children with coexisting depression and conduct disorders become adults, they tend to use more healthcare services and have higher healthcare costs than other adults. If the system does not appropriately screen and treat them early, these childhood disorders may persist and lead to a downward spiral of school failure, poor employment opportunities, and poverty in adulthood. No other illnesses damages so many children so seriously." The 2001 U.S. Department of Health and Human Services report of the Surgeon General's Conference on Children's Mental Health stated the following: "An estimated 15 million of our nation's young people can currently be diagnosed with a mental health disorder. Many more are at risk of developing a disorder due to risk of factors in their biology or genetics, within their families, schools, communities, and among their peers. There's a great need for mental health professionals to provide the best available care based on scientific evidence, good clinical expertise, and that takes into account the unique characteristics of the child or adolescent. However, it's estimated that only about 7% of these youth who need services receive appropriate help from mental health professionals. Therefore, it goes without saying there's not only a need nationally, but in our area as well. Last year, there were 139 admissions to the CPC, with the average length of stay, as we heard, being 3 months. The West New York Children's Psychiatric Center provides the kind of treatment that can help youth living with mental disorders address their issues in a secure and comfortable environment. I've had the opportunity to visit the West Seneca campus on many occasions and can testify that the facility is conducive to provide the kind of special care these children need. Not only is the building itself well equipped to help the children, but the staff are extremely committed to serving the needs of the residents. In the same respect, I was a patient at the Buffalo Psychiatric Center twice early in my recovery. I was not a patient in the Strozzi building where the proposed move was being recommended. Nonetheless, I was in an environment that was shocking, to say the least. The setting was institutional, and the other patients dealt with issues so severe that at times I was fearful for my safety. It's reported that if these children are to be moved, then they will be housed in a separate unit. My question is this helping or hurting them? I know how I felt when I was there. I cannot even imagine being someone who is the age of 4 to 18 and having to endure these conditions. Having to be in PPC will prove to reinforce the trauma that many of these children have already experienced. Having not only been a patient at EPPC, but also the former Buffalo General Hospital Community Mental Health Center, known as A.D. Goodrich, and also Erie County Community Medical Center, I've had the experience of living on a locked ward. The feeling of being closed in and unable to move about is distressing, to say the least. If forced to live under these conditions at BPC, I believe the children of the Children's Psychiatric Center will endure the same kind of stress and be further traumatized. The effect will be a result of living in an environment where being restricted is the norm and the lack of freedom to be outside is counterproductive. The difference between the current grounds of building at BPC are like night and day. It does not take much to see that the West Seneca facility is more therapeutic for children and provides a better learning environment. There are other wider implications for the closure of the CPC. First, the closest children's psychiatric hospitals are in Elmira and Syracuse. Therefore, even if a child needed this more specialized treatment, the distance would be more problematic for the families. Second, the fact there is currently a waiting list for the CPC is also an issue. Reducing the number of beds only increases the pressure on families. This decrease in patient beds will potentially cause children to be moved out more quickly to allow for new patients to be admitted. Third, adding the children units to the BPC will result in a loss of sorely needed beds for the adult population. Fourth, once the closure takes place, will New York State ever consider once again having a facility dedicated solely to children in West New York, at least in the near future? What will happen if the move ends up being unsuccessful? Fifth, the CPC's operating cost is about $20 to $22 million, but receives between $15 to $17 million in Medicaid funding. And finally, despite what may be said about the move to BPC, the Children's Psychiatric Center's staff could potentially run the risk of being reassigned, thereby losing the ability to work with a population they so dearly care about. Since 1970, the Western New York Children's Psychiatric Center has been instrumental in giving over 12,000 children living with mental health challenges an opportunity to heal in a caring and nurturing environment that fosters wellness and recovery. Without this care, who knows where these children would be? The CPC has the lowest rehospitalization rate in New York State out of all children and adult facilities. Many children have received the care provided by the CPC, have gone on to mature into adulthood, and take on the responsibilities that otherwise would be difficult to manage. Our kids deserve the best treatment possible. Is this accomplished by moving them to the Buffalo Psychiatric Center? I don't think so. These children are already vulnerable, and being housed at BPC will do nothing but add to their already difficult experience of living with a mental health disorder. We need to provide our children with the opportunity to receive the best kind of treatment available. The Western New York Children's Psychiatric Center received a 99.9% rating by the Joint Commission on Accredited Healthcare Organizations in 2012 and was given a special designation as being the top 10% of hospitals accredited by the Joint Commission in the nation. Why would we want to close a problem that's rated so highly? As a mental health professional and consumer, I strongly oppose the proposed move of the children from West Seneca to the Buffalo Psychiatric Center. Money should not be the driving factor when it comes to the care of our kids. Frankly, it is the wrong thing to do. Once again, I'd like to thank you for allowing me the time to speak on behalf of the Western New York Children's Psychiatric Center.